Healthcare is one of the most important issues for Americans, and for many, it's getting more expensive. That's the focus of our new series, Premium Pain, all this week on Morning Rush. We're looking into the growing cost of healthcare and the challenges Americans face when it comes to paying for it. And you've likely noticed next year's health insurance premiums are climbing. Business and tech correspondent Maura Barrett joins us now with more on this. And Maura, what is exactly behind this price hike?
Holly, it's affecting so many people. Whether you purchase insurance through the marketplace or get coverage through your employer, the price you pay for healthcare premiums each month is going to go up. And policy analysts that I spoke with blame inflation, higher prescription costs, and more frequent use of care. Whether you're on public or private insurance, you should be padding your budget line for premium costs going into 2026.
Anytime things like health insurance increase, it makes you uncomfortable.
Affordable Care Act plans, which enrolled a record 24 million people this year, will see an average 26% increase next year, with some states seeing astronomical increases if the enhanced premium tax credits expire. Meanwhile, costs for employer-sponsored plans are expected to surge nearly 10%, the largest increase in 15 years.
Jaw hit the floor. Going up to paying almost $1,200 a month it's going to be very, very difficult.
This comes as employees are battling inflation and stagnant wage growth.
The cost of their premiums is growing faster than their wages are growing. Then it's just eating up a higher percentage of the amount of money that they take home.
Employers, they want to provide robust coverage, but they can't. It's becoming a barrier for them financially.
Noel Cruz consults on benefit packages for employers who typically cover a large portion of premiums.
It's a balance between salary and it's a balance between what we can pay for on the benefit side.
Health policy experts recommend you arm yourself with information when comparing plans to best understand your coverage and provider options.
I think it's definitely worth looking at your estimated health expenses and your family's needs to determine which is going to be the best option for you financially.
Now, there's understandable concern about people who need coverage being priced out. A lot of state insurance officials have called that out as being a problem. It's especially concerning around the possibility of young people opting out of ACA markets. And health policy experts that I spoke with note that there's this risk when anyone goes uninsured, obviously, but ultimately insurance markets rely on this wide variety of people pooling payments in. So whether you're young or old, healthy or sick, we all help pay for each other's coverage, Holly.
And so if employers now are looking for a balance, so to speak, in their benefits package, what elements might be compromised?
Compromise is the key word when you're looking when you plan to look through the different packages that your employer might offer. The benefits consultant I spoke with that you heard from there mentioned the idea of narrowing networks, so narrowing down the amount of providers that are covered on your plan. So if there used to be 5 doctors included under primary care, it might shrink down to 3 doctors, for example. He said they're also embracing more telemedicine options, which can be cheaper, and that could be something that's offered for anywhere from mental health, so your therapy sessions, to physical therapy, which is an interesting development. Another analysis called out that employers are embracing more of the high deductible plans as well as those HSA investment options for employees as well. And so all of this is about that balancing act to be able to offer robust coverage, but also keep copays, deductibles the same rate, while employers are hopefully not passing on that added cost to their employees, Holly.
All right, Maura Barrett, great explanation. Thank you for that.